This is Dr. Vaishali and I am reading from the book Structure, book written by Dr. Rajan Sankaran. Road to Understanding of Boron. Properties of the boron. Boron is more like carbon. In its compound, boron acts like a non-metal, but unlike most non-metal, pure boron is an electrical conductor like the metal, and carbon like graphites, and crystalline boron is similar to diamond in appearance and optical properties, and is almost as hard as diamond. Boron has several important applications in the field of atomic energy. It is used in an instrument designed to detect and count slow neutron. Because of its high absorption of the neutron, it is employed as a control absorber in a nuclear reactor and as a constituent material of neutron shields. Understanding of the boron. Boron is at the meeting point of row 2 and column 3, where the feeling is, do I want to be attached or do I want to be separated? Am I in and still connected to my mother, or am I out of the womb and separate? They want to hold on. Boron is a stage where there is a further descent of the head in the womb and the baby is now descending in the womb. Rubrics of borax expressing these feelings which are mentioned below. Number 1, labor pains dart upward. Fear of downward motion holds on the nurse, which is mentioned in the complete repertory. Fear of downward and upward motion, which is also mentioned in the complete repertory. Labor pain dart upward, head of child goes back, which is mentioned in Lilienthal. Now the case of boron. Case of 50-year-old man, he had many problems. One of the most intense is facial neuralgia. Another concern is that he gets sleep apnea, for which he used BiPAP mask and mask each night. And I had given him 3 remedies in the past: sanguinaria, chelidonium, and the ranunculus bulbosus. But there was no significant changes, so I did a retake case taking, and with on 27th of November 2004. Patient said, last 1 month when I get pain, my teeth are getting scratched. Hard gesture. This is automatic and it is very severe. Constant shooting of pain. Very strong gesture of the finger coming forwards with a lot of speed. Constant pain like this way. Suddenly, like a bullet is starts and it is gets over. The eye become watery. On the train, if I sit or sleep, saliva comes out and flow of saliva has tremendously increased nowadays. And doctor asked, what? Tell me a little bit about this pain. And he said, it is it is on the right side, inside the nose. It is so bad that I can't brush in the morning. Suppose you want to shave, you can't. When you pull the skin up, it gives a jerk. Even doing this, it paining me. Now it doesn't hurt. When I am in a cell meeting or talking to client, it suddenly starts. Here is the conclusion. When he say shooting, he shows it like a jerk. The nature of the pain is the nature of the jerk. It comes very suddenly and then it is gone like a jerk. This is what we observe in him. He would get into the panic and rings us, almost crying and begging for help, saying, doctor, do something for me. And now further, doctor asked, what do you do? And he said, I have someone else with me. I can't chew things. Very difficult. But these pains are bearable and tolerable with your medicine, which previously it wasn't. And previously I used to hold on to some solid things. Some bars when the pains were there, and the frequency was every 1 or 2 minutes. And I am living with this, getting used to be it, because I know this is not curable. So I avoid participating in any dinner and function because it looks very bad. Previously, this pain was so bad, like someone was putting a pin into my skin, like an injection. Suppose you hurt yourself and there was a blood, it is a damage. Suddenly, you get a jerk in your body, and suddenly, someone putting a cube of ice in and take it out. What will happen? That will be a very simple pain. So, you are, I repeat this paragraph as I can't understand. Previously, the pain was so bad, like someone was putting a pin into your skin, like an injection. Suppose you hurt yourself and there was a blood, it is damage. Suddenly, you get a jerk in your body. And now, suddenly, someone putting a cube of ice in and take it out. What will happen? That will be a very simple pain. Doctor asked, so you are getting three types of pains. One is ice, the pain, someone putting something on you, which is this is the one that bother you the most, right? And he said, yeah, okay. Patient say all of them, and they are all severe. I'm with living with this pain. And another things, the air bother me. Today I am normal. The air doesn't bother me. I can drive. When the pain is more, then the air and the jerk will bother me. It is not just so severe. It is comfortable. Only things is that I have to hold every 15 to 20 minutes. When I put the mask on, it immediately gives me a jerk. I try to put something soft here. So the only way out is that today when I try that mask, some house members sits by me and hold my hands for some time, and I get jerk. So that first half an hour is very crucial. Then I sleep. If there is a noise, also I get up. And so if someone sits next to me and holds my hand, in half an hour I am off. But if I miss that, then all the nonsense starts. Sleepiness, salivations, and I can't walk. If I am in the house, talking or sitting, it starts suddenly, gives you intimations that it is coming. It suddenly shoots up. It is like a man who is sleeping and suddenly somebody does something to him. Suddenly he gets up and it is a shock. And during that time, it is very, very painful, and I feel like holding whatever is available just to control myself. Then it goes away. Doctor asked, describe these things. You said that a man is sleeping. He said, okay, Mr. A is sleeping. Suddenly someone goes and press his neck. He gets a sudden shock. Suddenly you get this and that too with the pain. And so that gives you a jerk in the body. But if I am not in the house, I have to control myself. Go somewhere where no one sees me, and I can't make a fuss in front of others who will like me. So I tell them not to take me out for functions in front of everybody. It's embarrassing. Doctor asked, describe the shock a little bit more about. And he said, suddenly you are completely out of yourself. It starts. So you want to hold whatever is available to bear that pain. Why does a patient hold someone's hand when he gets injection? Because he wants some support to bear it. Similarly, he wants someone or something to bear this jerk, and that pain is very, very severe. I have been to every doctor in the city. This jerk comes suddenly and unexpectedly. It comes in a shooting manner like a bullet. It comes for 60 to 90 seconds and again starts. Comes and goes, and I become watery and red. Only in that part around the eyes. Because of this, a man like me can't go out anywhere, and when it suits, it's so bad that if you don't control yourself, you don't know what can happen. I may faint, become unconscious because of this shock, and it is that unexpected. The only things you can think of at that time is to control him, looking for someone to pat, or pat means hold on. Doctor asked, what are you showing me with your hand? And he said, I want something to hold. I hold the bar of the window. I try to remove the mask first and save myself. And somebody holding my hand. I try to remove the mask. Very strong actions. Because of that mask, that is a press here and get the pain. And that's why someone is there to control me for half an hour so I can go to sleep. Once you settle down, you are off. That's shooting off the pain is so bad. Now, conclusion is what was interesting about him was just like he needed to hold on to something. He also needed to hold on to somebody. The main person was his wife. He would never let her out of his sight for 1 minute. If she went, he would ring every minute asking, "Where is she?" And in the same way, he held on to us at the clinic. And this behavior is very, very childish, almost infantile. Doctor asks, shooting like a bullet comes and goes suddenly, jerk, shock, etc. Describe this more. And he said, sometimes it's shooting like a bullet. Sometimes it like putting something on your body, like an ice cube, and they are all different type of pain, which they were earlier. A man gets a shock. Similarly, I get a jerk. Here again the conclusion is what? So far the talk about his pain, which is very severe shooting pain like a bullet and it starts suddenly. He said it is like a pin, like an injection, or it is like a wound or like a cube of the ice. He speak about three type of sensation, but what is common is the sudden and jerk. The word jerk seems very important. Sudden jerk and words from jerk. So on the one side we have this holding and controlling, and on the other side everything is going down. Here the holding is very significant, and it is not just holding, it is holding very, very tightly. Incidentally, the English word for holding very tight is grasping, holding something very firmly. Here one could also think of a Loganiaceae family, but in Loganiaceae, where along with a jerk on one hand, one should also see paralysis or the opposite sensation. Doctor asked, describe a shock and jerk, just those words. And he said, a man who is not expecting something that give you a shock. Similarly, you are not expecting a pain, and this comes at any time. Zoop! I did not say it gave you a shock because now you are used to it. Today it's pain that I am used to, so it is not a shock, but it is unbearable. Now doctor asked, what is the action you are showing? And he said, suppose you have a compass in your hand or a pin that someone pushed, you get a shock and you get a jerk because that what bothers you. And similarly, it just starts and you get a shock, a jerk, something is poking you, like somebody puts a pin in your body. Similarly, it is just shooting up at any time, and I want to have support. If you don't have support, then you are liable to fall down or be unconscious. You need support to bear that pain. If I don't take a mask, I will die. The oxygen doesn't reach the brain, and I can't take it with a pain. Here conclusion is what? At this point one could also think of umbellifera family, and but holding is not in umbellifera. The sensation and its opposite have to be there. It has to be equal and opposite. There is no opposite sensation. The holding on is very strong. That's why the reaction is very important, because the reaction is opposite to the sensation. So what he must experience is the opposite of the holding on. But it is lacking here. And doctor asked, when you say you need support, means what? And he said, it suddenly starts, so you need support. When you are you are standing in the train, you need support so you don't fall down. Doctor asked, describe support so you can bear the jerk, and describe jerk means what? And he said, jerk means it gives you a shock. Suppose someone comes in front of you and you need a brake. Putting the brake is a jerk. Similarly, you get a jerk. When the pain comes, it gives you a shock which you have to absorb it. You have to control and bear this so you don't damage yourself. So for bearing this, you are required that much of courage. And this is very strange things to say. I want support, otherwise I will fall down. It is the shock. I have to absorb the support, bear it, otherwise it will fall down. Anything will happen if you do not hold. No plant family will talk like this. Now doctor asks, what does damage means? And he said, you may fall down, and falling is only due to jerk, which is unexpected. An asthma patient get an attack on the train station. He can't breathe. It may cause something bad. Similarly, if you don't hold something when you have that pain, anything can happen. You must need that support. It is extremely bad. The coming of the pain is so sudden and so fast that one is not ready for it. And how could he be ready for that pain? And doctor asked, describe me this fast and sudden a little bit more. And he said the speed of the pain is very fast, that you don't get time to think about it. You have to have some moral support anywhere, that you can bear it, and it comes very fast and it doesn't give you any time of intimation. And doctor asked, just talk about the word escape and save yourself. Let me go back. What is the difference between a spin bowler and a fast bowler? Patient explained this feeling. And speed is so fast that you don't think of anything, and then one has to have some support somewhere, and during that time of the pain you have nothing else is in your mind, and you just want to save yourself to survive. This has comes, can you escape? This has comes, and can you escape at that time? And doctor asked, just talk about the word escape and save yourself. And he said, escape means avoid. Can I save myself? It means see that it doesn't affect me much. Can I survive with it? Can I live without it? Can I live with this? Doctor asked, so how does this pain affect you? And he said, it has spoiled my life, family life. They have to constantly look at me, and whenever I go, I lost my job also. It has affected me so badly. My routine is so upset, and I can't sit at home. I want to work, but I can't work. I'm a sales engineer, and I have good offers, but you can't sit and talk to somebody for 2 hours. I have to take the mask, take oxygen, everything, and it costs money. And so all this has affected my life, and my family has become a miserable for this, and I have totally been a failure now. I can't do anything, so everyone tries to give you mercy, and which I don't like, so I avoid going out. Tell me a little bit about your childhood. And he said, in childhood I had eczema. Eczema came to asthma, and I was working in a company with oil paint boxes. The smell used to give a very bad sensation of the asthma. After it got cured, I completed my education. Unfortunately, I started smoking, and I used to travel a lot. Only I could do it, and people used to wonder how I manage. Only things was that my smoking became very bad, and then started all the COPD symptoms and problems. About 20 years back, I fell down. The nose was in my hand. Then immediately I was shifted into some hospital, and it was operated. My both legs were twisted, were hanging. Something came out of my hand, like dead skin and drafting. And how this neuralgia come into the picture, I don't know. It started over 15 years. Suddenly it started paining. It got better and then bad. Generally I was very active, and I used to love traveling. I used to play a lot of cricket. Now explain any interests or hobbies. And he said, cricket. Hobbies are music and picture. I like war picture and air crashes pictures, and the aircraft goes into the sea. One picture is that the captain is killing due to the eating something, and air hostess is driving the plane. One more, the Concorde. This type of picture I like. There is one passenger who carried the bomb. I love aircraft pictures, trains, bank robberies, and war pictures. There was a picture called Silver Streak, a brand new train, and how it gets into the massive accident. It is going towards Paris stations and running at the speed of the sound, and without a driver. It is excellent. I don't like horror picture like Exorcist. Doctor asked, tell about this air crash and picture you like the most. And he said, I like the one where I went into the water and they all survived. Aircraft loses control and it comes down so fast that it straight away goes into water, and there are a passenger inside. Doctor asked, so what will be the experience of this passenger coming down so fast? And he said, must be panic. And doctor asked, describe panic. And he said, they will think that how are they going to survive? And doctor asked, how will they experience this panic inside? What will they experience at that moment when the thing is going down? And he said, very much abnormal. And doctor asked, describe this panic, what will they feel? And patient says, very difficult, some may faint also. And doctor asked, what will be the experience of that fainting? And he said, unconsciousness, man is unconscious. Now conclusion, this gives us the miasm which is acute, because in delusion he doesn't experience it as malarial. He feels like it is acute. When the plane is going down, he doesn't feel harassed. He feels it is as an acute attack, acute problem. Doctor asked, what would make him unconscious? Why would